Good evening, everyone. Welcome back to our weekly show. So you are tuned in to Estudiante Blues, only here in the Greatness Hub online channel. This is the only online channel affiliated with iHealth Coaching and Business Solutions Incorporated. So I will be your host this evening. My name is Coach Luz at your service. But before we begin tonight's episode, let me first invite everyone to please subscribe, like, and of course, watch all our shows here in the Greatness Hub online channel, the only online channel affiliated with iHelp Coaching and Business Solutions Incorporated. So let's go to our discussion. Okay, so our topic for this evening is entitled Mental Health Awareness During the Pandemic. Okay, so we will be discussing the importance of maintaining mental health, particularly in times of the pandemic situation we are all experiencing right now. So before we dive into our discussion, let us first identify our objectives to be achieved in this episode. So first up, for our discussion tonight, so we would like to achieve the objective of creating an awareness on the importance of mental health, specifically during this time of pandemic. So why is it important for us to maintain our mental health? And second, for us to be able to create an environment that promotes mental well-being, specifically during this time of pandemic. And lastly, to develop a culture based on trust, support, and the mutual respect wherein we people can share our issues and concerns without fear of judgment or condemnation. So without further ado, let us discuss our topic for this evening. Okay, so what is mental health? Accordingly, health is wealth. Without health, we cannot enjoy our wealth. So early on in our life, we use our health to accumulate wealth. We work very hard so that we'll be able to gain money and eventually save, and enjoy life's activities. We can buy anything, we can go anywhere because we have wealth. But eventually, in the later part of our life, when we are downing already, we reach the peak and we are moving towards old age, there are instances wherein all our accumulated wealth is being used to regain back our health. But isn't it good to know that at this particular point in time in our life, when we are still strong and we can still take good care of our health, basically we need to know how to take good care of our health so that in the long run, when we will reach the later part of our life, we will not be using all our accumulated wealth to regain our health. So take good care of our health this early part of our life so that we will still be enjoying all the perks in life in the later portion of our journey here on earth. Okay, so according to the definition of mental health, it can be defined as a state of well-being. A state of well-being wherein each individual realizes his own capacities, abilities, and limits, can cope with normal stresses of life, our daily struggles, and can work productively. Basically, all of this is towards our ability to contribute to our community. And of course, mental health, this requires a balance between our body, our mind, our spirit, and of course, the environment in which we all live in as an individual member of our community. Okay, so by means of having mental health, and we recognize our abilities and limits and our ability to cope up with life stresses for us to be able still to work productively and make contributions to our community. According to World Health Organization or the WHO, health is simply a complete state of physical, mental, and social well-being. And basically, this is not just the absence of a disease or an infirmity, meaning it does not necessarily mean that you have a mental disease for you as an individual to have mental health concerns. Okay? It does not mean that when we feel like we are physically healthy, we are in a sound mental health well-being. And it does not necessarily mean also that if we can associate well with other people, we also enjoy a sound or a good mental health. It is an interplay of our physical, our mental, as well as our social well-being. And of course, it does not necessarily mean that if we are not diagnosed with mental illness or physical disease, we are experiencing a sound or a good mental health. So, what is a good mental health and what are its manifestations? Right. According to the World Health Organization, yeah, mental health is actually a very integral part of our overall health because basically there is no health without mental health. A person who has a good physical condition is not a guarantee that a person has a sound or a good mental health well-being, right? Meaning, if even if you are in good physical condition but you are suffering from a mental concern, your physical well-being might also be affected and your entire activity can also be put into jeopardy. So this means only that we must really take good care of our mental health, not only physical, not only social, but also a good balance between the three aspects of our total well-being. And that being said, yeah, for us to be ensured, assured that we will be able to maintain our mental health as an individual, our government actually has created a law for all individuals to be able to enjoy, ayan, enjoy access to mental health services as well as mental health facilities because at this present moment, particularly during the time of pandemic, we as an individual and as a country and as a nation also and as a population, the entire world has really impacted by the COVID-19 situation. And this pandemic situation really has put a toll on our total well-being. And it's a good thing that our government has already released an RA Republic Act known as RA 11036 or betterly known as the Philippine Mental Health Law, wherein mental health facilities and mental health services are actually being given access to almost the general majority. So mental health services are given down to the barangay level for individuals to be able to enjoy mental health services, easy access to mental health services to help them cope with the different challenges of daily life crisis or daily life experiences. Okay, now for the students, for the entire school year 2020-2021, different concerns plague their daily challenges, daily life experiences, particularly school-related and family-related concerns. So let's discuss different mental health issues and concerns of the students, particularly during the time of the pandemic. Okay. So first up, mental health issue of students during the COVID. First and foremost concern of students is health concerns. So with the onset of the pandemic situation, everyone, as in everyone in the entire community, including the entire country and of course the world, we all had and still having health concerns because the COVID situation is really, really new. And with the limited information during the onset of the situation, we can only see, we can only know a little about this pandemic situation based on what we see on television, what we see on social media, and not knowing what this is and identifying or knowing or exposed to the different kinds of threat, we, especially the students, were very concerned of their particular health in connection with the COVID situation. So, since little did we know about the COVID-19, how we get infected, and with the majority of fatalities associated with COVID-19 until now, with the rising number of patients being afflicted by the disease and the dreaded aftermath, really, it's a known fact that everyone, young and old alike, have health concerns with regards to the COVID situation. It's a good thing that now we already were given vaccinations and a lot of vaccines are readily available. You can take your pick. The vaccine has already given us at least some peace of mind when it comes to our mental health. But still, it's very, very important that we have to follow safety protocols. And if we do not have important things to do, might as well stay at home so that we will be able to address our health concerns, health issues related to the COVID-19 situation. Another health concerns during the COVID-19 associated with the students is that they find it difficulty concentrating. All right, this can be associated with social media. That's one. Since we, as a population, were detailed inside our home, and the only means of our connection with the world is with the social media, with internet connection, with our cell phone, and with the classes being done online, and a whole lot of distractions associated with the internet, students actually find it difficult. They have a challenge when it comes to concentrating because they have a whole lot of distractions in their hands and they spend most of their time in the social media. Okay, so how do we deal with this? We'll discuss that later on. Okay, so one concern of students during the COVID-19 is difficulty concentrating. So simply said, when we have difficulty concentrating, solution is we have to stay focused. Next up, for their mental health issues and concerns related to students during COVID-19 situation is the disruption of sleeping patterns. According to research, which is the basis for this particular topic, during the pandemic situation, a whole lot of students, young and old, they did encounter disruption of sleeping patterns. This is associated with their extended exposure to one, of course, is social media, internet, Netflix at that, binge watching Netflix, I included, and of course, and online games. Basically, since everything that we do during the pandemic situation is online, so students, parents, young and old at that, they had extended use of different online sites to take their mind away of the situation and of course to amuse themselves. So somehow with their extended use of the internet and the social media, it has affected their sleeping patterns. And on the downside of it, so some students had difficulty, of course, sleeping. And at certain times, they do sleep extended hours. And eventually, since it has become part of their daily life, it has become a lifestyle. End result is that they have developed a disruption in their sleeping patterns. Next up, next of their mental health issues, particularly of the students during the COVID-19 situation, is increased social isolation. So increased social isolation, meaning even if they are internet connected, even if they spent most of their time in the social media, even if they've been hooked to Facebook 24/7. During the pandemic situation, students had an increased feeling of social isolation since they've been away from their friends for the longest time. It has been like 1.5 years already, and this pandemic situation really has a 360 degrees shift in the way we live. Students are not used to being exposed to the relationship online that much. They still long for the kind of relationship that they had face to face, and adjusting to purely online has left that feeling of isolation even if they have global access to relationship, but maintaining quality relationship with other people elsewhere is not that their main concern. Relationship during the kind of face-to-face situation that we are used to has left them to adjust to the pandemic situation when it comes to maintaining relationship. And this has actually become one of their concerns during the COVID-19 situation. Okay, so next up is that students during the COVID-19 situation has concerns with academic performance. This is one of the major concerns of students, academic performance. Since the mode of instruction has shifted from the face-to-face to purely online or hybrid kind of learning mode of learning rather, academic performance of the student has been affected drastically. There were a lot of adjustments. There are a lot of learnings that they have to accommodate for them to be able to adjust and thrive to the new normal, as we call it, the online mode of learning. And the online mode of learning has actually put a heavy toll on their mental health. And in congruence to their academic performance, there is also a disruption on the eating patterns. Okay, so one of the mental health issues and concerns of students during the COVID-19 situation is disruption of eating patterns. If you're going to look back and reflect on how we lived for the past almost 1.5 years, particularly during the onset of the pandemic situation, none ever has prepared us in this kind of global scenario. Locally, even in our community, we have never thought that the global pandemic, the COVID-19 situation will be as long as more than a year. During the onset, we have never thought that this would last for a month, even a year, and now we are nearing 1.5 years of being detailed in our home. So during the onset, we were not prepared financially for this kind of situation, and definitely all aspects of our daily life has been affected by this. And eating pattern is also one of those aspects being affected. Basically because we were detailed for the longest time inside our house, and the young people at that were not allowed to go out of the house. So whatever is saved, whatever is bought, whatever is stocked in the house, we are limited to consuming all of this. And if families were able to stock for a month or so, majority of the items stocked in the house are basically processed food. And since we are not allowed to go out, consuming fresh foods are very limited. And since we are all stressed during that particular moment, stress eating is also part of our daily life activities. Hence, our regular healthy eating patterns were affected, particularly during this time of pandemic situation. Next up is changes in the living environment. Changes in the home environment and environment at large. So what happens during the pandemic situation when it comes to the living environment? So from the regular face-to-face classes comes the pandemic situation. And what happens next is that we are all detailed in the four corners of our home for the longest time. And since human beings are dynamic individuals or dynamic organisms, we have the tendency and the need to move about. Okay? And since we are not allowed to go out of the house so much, so wander around the way we used to, okay? We accommodated all our activities inside the home with the entire family 24/7. On top of that, we also had our classes in the different corners of our house, and this has become our life for 1.5 years already. And since we cannot do anything about it, we have to accommodate the change, adapt to the situation, and of course, thrive. But all of these adjustments that we had and are having at this particular point in time, this has put a toll collectively in our overall mental health. And this is the greatest challenge of them all. So the mental health issues of students during the COVID-19 situation, the biggest challenge of the majority is financial difficulty. So if we are going to look back of what happened during the pandemic situation, since we are all imprisoned in our homes for the longest time during the onset of the pandemic, in most cases, companies cease to operate. And because of the situation, some employees were let go. Companies actually downsized. And those who were let go or those who were part of the downsizing, financial difficulties sets in. And since financial limitations are one of the concerns of the families, everything needs to be adjusted. There are students who did not enroll because of financial setback. There are students who were able to find employment just to, even part-time at that, just to earn some money for their daily needs. And there are those who were creative enough to be able to create their own business during the time of pandemic. But one of the concerns which put a toll to the mental health of students until now is battling with financial difficulties. Another concern of the students during the COVID-19 pandemic is increased class workload. Is there really an increase in class workload? If you're going to ask the students, never had a time in their academic journey that they felt more stressed out, super duper exhausted, and it seems that during the pandemic situation, really there is an increase in workload. But come to think of it, the number of units they enrolled during the first and second semester were actually the number of units they will be enrolling, even if it's face-to-face situation, but the adjustments that all of us needs to accommodate during this particular COVID-19 situation, the adjustment per se actually really puts a toll. The students during this particular time were more tired. They really have to make double time, and it's very, very exhausting to have classes online, even if the class time is cut short because of attention span concerns, and never had teachers become more considerate of their students because of the adjustments that everybody has to accommodate during this particular COVID-19 situation. But still, one of the mental health concerns of the students during this particular COVID-19 situation is their perceived increased class workload during the entire school year or the entire semester. And because of these issues and concerns, ayan, there is actually a rise of depressive thoughts. So where does the depressive thoughts come from? If we are to think back of the different issues and concerns that we have discussed, the heavy load puts a toll on their mental health, their physical health, and the social health issues compounded, and students actually feel depressed with the heavy burden that this COVID-19 situation has put into their young minds. If we get to talk to students, actually they really feel burdened. And the burden that they are carrying at this point in time actually comes from the different issues and concerns that we have discussed. And if these depressive thoughts, if these thoughts were left out and were not dealt with, we are not able to put a check on this, the next thing that they would be experiencing is suicidal thoughts. Because they thought that this suicide thoughts is actually their only way out. That's why we're discussing all of these things. We have to really put a check on what our students are experiencing at this point in time. Because at the end of the day, giving them the empowerment to handle these kinds of situation could actually save lives. So how do we deal with this? So all of these things actually come from one single word. This is stress. So stress is a very popular word, but what really is stress? So simply put, so stress, we put it as an acronym. Okay, so acronym meaning S for sickness, T for tasks, R for relationships, E for emotions, S for surroundings, and of course the other S is solution to financial problems. So how do we deal with all of these stresses that is compounding and really putting a toll on our physical, social, as well as mental health concerns? So, if we are to handle stress, yan, simply put, we deal with stress by simply reducing your stress. One thing that we have to do is that we have to recognize that there is really a red flag. Now, what is a red flag? If you are feeling stressed out and if you feel like you cannot really handle the heavy burden, acknowledge that you need help. And acknowledging help, meaning acknowledging that there is a need for you to be helped only means that you have to reach out. Okay? So reaching out to whom? Yeah, we have your social connections with you. So how do you reduce stress? Come to think of it, you are the best person to identify your stresses and your stress limits, your stress threshold. So if you feel like you really are stressed out, first things first, acknowledge that you need help. So how can you be helped? You have to reach out. You have to reach out. So sino ang tatawagan if you want to reach out? Sabi dyan, if you are stressed, the only solution that you have to take into consideration is take a rest. Yan. If you are stressed, take a rest. So how do you take a rest? Yan. So first things first, R for the rest is relax your mind. Everyone in this entire universe, we all have problems, we all have concerns. But sometimes we actually take too much of our time thinking of problems and concerns. If it's not your problem, yan, don't make it a big deal. Always take into consideration that everything that is given to us, it's a blessing in disguise. Daling sabihin ano po, it's a blessing in disguise. We will not be given challenges in our lives if we really cannot handle such. Okay? We are not given challenges in this life if we cannot handle such problems. At the end of the day, we can use all our capacities, our resources, our creativity to find solution to the problem. If your problem is too heavy and you think that you are too burdened for that problem, ask help. So, kanino ka hihingi ng help? One is that you have your family with you, but in most cases, the family is the last people to know of your problems. If you feel that you cannot connect that much to your family, you have your friends with you. If you feel like you are not comfortable enough to share your problems with your friends, your family, you have your teachers with you. If not teachers, you have your guidance counselors with you. You have your school community with you. You have your church community with you. What's important is that you have your support system with you. Okay? So relax your mind. Ask for help. ask assistance. It does not necessarily mean that you ask for help. People that you seek help with can provide you with solutions to your problem. It's not that easy, but sharing your burden with others, you might find wise advice. You could actually find consolation. And at the end of the day, knowing that your friends, your associates, your school, your family is there with you to be with your journey is already the first step to handling your concerns, your problems, your issues. Next part of the rest is that you have to be engaged in doing something exciting. Engage in something to do which you find happiness in doing. It doesn't matter how trivial it is. At the end of the day, find something that makes you happy because having a happy pill every single day, it produces positive hormone and positive hormone leads to positive health. And doing something that you love motivates you to do something more. S is search for something motivating. Something motivating is something to do with an activity that push you to the limit or push you to achieve more. At the end of the day, babalikan ulit natin yung something exciting, something motivating, something that you will look forward to doing because it excites you, it motivates you to do something more. And lastly, talk in positivity intentionally. With everything that's happening right now, all the negativity that's happening in the world and all the negativity that we are actually putting into ourselves, the best remedy for all our negative energy is to intentionally be positive because the intention in itself is already something to look forward to. Come to think of it, you are what you think. So it all starts with a thought. The thought becomes an action becomes a habit, and a habit becomes a lifestyle. So if you want to be positive, you have to think positive. And for us to be able to handle whatever life throws at us, we have to think positively. Okay, so for us to be able to address all our concerns, mental health concerns, physical health concerns, all our stresses, okay, we are the best person to be able to reduce our stress. And reducing our stress, simple solution is to actually take a rest. So relax your mind, engage in doing something exciting, search for something motivating, and of course, intentionally talk in positivity. If we feel like we are having mental concerns, ayan, so we have to stand up for the stigma. So what is a stigma? So when we say stigma, these are actually all our negative definition of something associated with mental health, illness or mental health issues. We have our stereotype of our definition of mental health illness. And 1 in 4, that is around 25% of every group of individuals, 20% of us, we have a stigma when it comes to mental health. So for us to battle our negative or our stigma when it comes to mental health issues, mental health concerns, these are what we can do. Ayan. So, one is that we have to talk openly about it. We have our thinking, our definition of mental illnesses, schizophrenia, ayan, bipolar. Those are different kinds of mental health illnesses. And we talk about depression, we talk about suicidal ideation, we talk about suicide. If you feel like you are experiencing these kinds of concern, okay, you have to talk openly about it. You have to let people close to you know how you are feeling. Because talking about it, sabi ko nga kanina, you might not be able to find solution to what you are experiencing. But the wisdom these people can give you and sharing your burden with others, you could get yan, pieces of advice, things that you can do, or just simply knowing that they are there for you could actually alleviate the pain, the burden that you are experiencing at this particular point in time. But what's important is that Share how you feel with people who are close to you, or find a confidant where you can freely discuss what you are having at the moment without reservation, without fear of being judged. Next is that choose supportive language that is not stigmatizing. One fear that we have at the back of our mind is that when we share our issues and concerns when it comes to our mental health concerns, mental health issues, problems and concerns, we tend to think that people would judge negative thoughts when it comes to mental health concerns. And if we are to voice out our concerns relative to mental health issues, tendency is that we are afraid of being labeled. And when we say being labeled, different mental health problems, issues, and concerns, and mental health illnesses actually labeled to us by other individuals. That's what keeps us from sharing our thoughts. Okay. Standing up to the stigma by means of choosing supportive languages actually helps individuals to conquer their fear. We are here not to judge. We are here not to put label, but we are here actually to support. Because there are a lot of people out there who are afraid to express themselves and open up because they really have fear of or the stigma of being labeled as people experiencing and mental health issues and concerns. Mental illness is just like any illness, right? So this is treatable, okay? It's just like flu. It's just like fever. But the first step is that we have to know the different signs and symptoms. And if we are able to know the different signs and symptoms of a particular mental health issue, then we are able to point the person to the right direction. And what is the right direction? Of course, ask the professional, mental health providers. That's why our government has already established the mental health law and the different services with regards to mental health issues and concerns are being brought down to the barangay level so that if you are not comfortable with the family, if you are not comfortable with the friends, if you are not comfortable with your community and the school community at large, you could actually seek assistance to professionals even at the barangay level. Because having mental health concerns is really, really very important to be addressed at this particular point in time. Basically because it's one of your foundation. If you suffer from mental health concerns, basically, sabi natin, there is no health without mental health. Other aspects of your life will be affected by it. So choose supportive language. Do not judge people with mental health concerns or mental health issues. Right? That's why we are creating awareness for everyone to know all these things. And the next one is to speak out to correct myths and stereotypes. Right? That's why we are having the awareness. No? We have to put a stop to the different myths and stereotypes. So people with schizophrenia is like this, like this, like this. People with borderline personality like this, like this, like this. Okay? So ulitin ko. People with mental health issues, mental health concerns, or even mental health diagnosis. They are just normal individuals having a mental health illness. And mental health illness is a treatable illness just like any other regular illnesses or diseases. Very, very important that we identify their problems and concerns, point them in the right direction, okay, support them for them to be able to become empowered and deal with whatever problems, issues, and concerns they are experiencing at the moment. Okay. So one myth associated with mental health issue is that a person, myth, a person who has suicidal thoughts, yan, or suicidal at that, we do not discuss suicide. Diba? If you know of a person with suicidal thoughts, we do not talk about suicide. But if you look at different literatures when it comes to suicide, the more you talk to the person, the more you identify his or her plans of suicide, the more you have to talk about the person, the more you can gauge the level of suicidal ideation he has, and the more you have to point the person into the right direction, because pointing the person to the right direction can actually save his or her life. Okay? And lastly, educate yourself and others. Educate yourself, so spread awareness when it comes to mental health concern. And spreading what you know about mental health, okay, this could actually help others having or dealing with mental health issues and concerns. And lastly, and this is actually my last slide, according to Bikram Patel, there is no health without mental health. And mental health is too important to be left to the professionals alone. And mental health is everybody's business, right? So we already established that there is no health without mental health. And since we are what we think, diba? And what we think is actually the foundation of our mental health. This one is too important to be left to professional. Meaning, the fact that we are having this mental health awareness talk and you being one of the listeners in this mental health talk, this is your business. Taking good care of your mental health is your first and foremost business, because if we put it down to the foundation, your personality, your health is dependent on your mental health. Okay, so do not put your mental health to professionals. Do not leave it to other people. It's first and foremost your concern. And it's everybody's concern. So take good care of our mental health and you'll be able to enjoy life to the fullest. So with that, thank you very much for staying with me for this episode. And I hope to see you again next week for another episode of our discussion here in Estudiante Blues, only in the Greatness Hub online channel, the only online channel affiliated with iHealth Coaching and Business Solutions Incorporated. So this is your host for this evening. My name is Coach Luz at your service. So I hope to see you again next week. Don't forget to like, subscribe, share, and of course, watch all our programs here in the Greatness Hub online channel. So bye for now, guys. See you again next week.